Hello, my people. I hope everything is per expected. Today, we are still tackling our point, our topic of the week, which has been sexually transmitted infections in conjunction with sexually transmitted diseases. Yesterday, we differentiated between sexually transmitted infections and sexually transmitted diseases. So, before we continue with our topic, let me thank you people for the support you are giving me. We are at 8.3 subscribers, road to 10,000 subscribers. Guys, feel appreciated, and let's continue subscribing, sharing, liking and comment on our videos so that they may reach as many people as possible. So, let's get back to our point of discussion, whereby we are talking about types of sexually transmitted infections. So, an infection is classified as a sexually transmitted infection if transmitted through sexual contact. However, there are some exceptions. For example, cytomegalovirus can be transmitted through sexual contact, but it's not classified or considered as a sexually transmitted infection, as it can be transmitted through other ways too. So, what are the common types of STIs? Human papilloma virus is most common, with chlamydia and gonorrhea heavily reported. That means gonorrhea and chlamydia are also classified as sexually transmitted infections. Genital herpes, syphilis, although rare, and also HIV infection, although these are rare, but they are also classified as sexually transmitted infections. One thing you have to know, there are some infections or conditions you will find them as sexually transmitted infections, and also you find them in the group of sexually transmitted diseases. The reason is because, as we said yesterday, some diseases must pass through, start as a sexually transmitted infection, then if left untreated, they become a sexually transmitted disease. I hope you get that. A point to note, if treated promptly or on time, most sexually transmitted infections are unlikely to become sexually transmitted diseases, but if untreated for some time, the risk of sexually transmitted disease is greater. Another point to note, not all strains of STIs can be cured. Not all strains of STIs can be cured. For example, some human papilloma virus strains can lead to cancer, and you very well know cancer is untreatable. So, some human papilloma virus strains can lead to cancer, and getting regular screening for abnormal cell changes is key to early diagnosis. So, let's talk about sexually transmitted infections and how they can be diagnosed, or how you can tell that somebody is having a sexually transmitted infection. So, laboratory tests and examinations help figure out whether you are having, or whether a client is having a sexually transmitted infection or a different condition. And these include: 1, rapid finger pricks. Rapid finger prick tests. This is whereby blood sample is taken from your finger, is taken to the laboratory, and tests, for example, for syphilis, which we know as VDRL test, is carried out. So if you are having syphilis, it will definitely test positive. Number 2, we have fluid samples which can be collected from the vagina, or penis, or the anus, or the source that erupt as a result of this kind of a disease. For example, in the case of herpes simplex or herpes zoster. We can also use urine samples, whereby you do urinalysis and also urine microscopy to diagnose a sexually transmitted infection. We have also pelvic and physical examinations. Pelvic and physical examinations. So, if sexually active, or if you know you can't do without sex, anybody who can never live without sex is classified as sexually active. So, if you are sexually active, and I insist on this, if you are sexually active, get tested regularly and consult your healthcare provider or your doctor as soon as you develop symptoms. So if you are sexually active and you start developing unusual symptoms, consult your healthcare provider earlier enough, as if this kind of a disease is diagnosed early, is treated early, and the risk of complications is reduced. So let's talk about STI or sexually transmitted infection complications. Always, in any diseases or any ailment, complications occur if the disease is not treated promptly or on time. So, increase of infertility is one of the complications. So, most of these sexually transmitted infections affect the reproductive system. So, definitely, if they are left untreated, they can lead to the risk of infertility. Number 2, they cause certain types of cancer. So certain types of cancer come up as a result of untreated infection. For example, cervical cancer. Number 3, they make a person more susceptible to contracting HIV virus. So some of these diseases put you at risk of getting HIV virus. Number 4, they lead to organ damage and death. Organ damage and death. For example, kidneys can be damaged as a result of sexually transmitted infection. A point to note: pregnant ladies should be aware that STIs can affect unborn baby and overall pregnancy too. This is for the pregnant ladies. They should be aware that sexually transmitted infections can affect unborn baby and the overall pregnancy too. Some sexually transmitted infections can be passed to the baby, and some sexually transmitted infections can be passed to the baby before, during birth, and potentially lead to the following. So what will happen if these sexually transmitted diseases are passed to the baby during pregnancy or during birth? What will occur to the baby? One, we have what we call infections. For example, we have what we call neonatal sepsis. Number 2, we have pneumonia. which is the infection of the chest or the lungs. Number 3, we have meningitis, which is the infection of the brain. We have blindness, as these infections, for example, syphilis, can affect the eyesight. We have deafness or hearing loss. We have brain damage, stillbirth, and lastly, premature labor or getting labor pains before the actual time of delivery. This marks the end of our first video. Guys, thank you for your support. Thank you for being with me. Thank you for your likes. Thank you for the subscriptions, and continue keeping the support on, and I know this channel is growing to greater heights. Let's meet in the next video.